My name is Jordan Michaels. I'm the CEO and co-founder of Ringadoc, and really excited to be here today. So I want to start by telling a bit of a personal story about how I realized, just like every other human, sometimes I get sick. So last year, I woke up with very bad pain in my stomach. I didn't really know what was going on. And like most of us, the first thing that I did was I went on Google, which we shouldn't do, but we all do, and I started looking around to see what was going on. So I went on there and I searched for stomach pain, and immediately I got this page full of tons of results I didn't really know how to interpret. The word cancer is on this page 3 times. Really was a little bit anxious, spent probably 2 hours self-diagnosing myself with rare diseases that I knew I didn't have, and didn't really have a resolution, didn't know what to do, where to go. And I started to ask myself, I said, I have health insurance, I have a primary care physician. Why is this the route that we're being forced to take as consumers? If you actually look on this page, Google has a disclaimer that says, consult a doctor if you're experiencing these issues. So what I did was I went and I called my doctor's office, sent a phone call his way, and was instantly thrown into a sea of live operators. This is literally probably what I imagine it looked like. I was talking to untrained professionals. They were literally there to block me out. They were asking me what was going on. They were misinterpreting what I was saying, and they were coming up with reasons why I couldn't or shouldn't speak to the doctor. And at the end of the day, they told me, I can send your message to the doctor, which they got wrong, by the way. They got my name wrong. They got my phone number wrong. The doctor might call you in 2 to 3 days, or you can come in for an appointment next week. Now, I'm sitting here. I've already wasted now 2 or 3 hours. I don't have time to go in for an appointment next week. I can't be sick all week. I'm going to be missing work. I'm going to be not doing really well. And even when I do go in, we know that this is kind of the experience. You sit here, you're waiting for the doctor. It is almost a little bit of a joke. I mean, they tell you the doctor's coming, they're backed up, and eventually, sure, you get in, but you wasted now potentially a week. So what actually happened when I had the stomach pains? Well, I actually ended up in the emergency room. I spent all day there. And I have on the next slide actually kind of what the experience looks like in the ER. You go there, and first of all, I didn't feel like I needed to be there. So I felt bad being there because my issue wasn't as concerning enough to necessarily be in the emergency room, but I had nowhere else to go and I needed an answer. So actually, I spoke with the doctor for less than 10 minutes, and I walked away with a prescription for amoxicillin. Turns out I had an infection. Because I was sick previously, and I guess it was an infection that needed antibiotics, and I didn't take them. So this trip to the emergency room ended up costing me, no joke, $4,000. I'm still paying this off a year later, and it really had my team and myself really thinking, there needed to be a better alternative. And that's essentially where we formulated the idea of Ringadoc. Why isn't there a better way for you to get in touch with your existing provider, knowing that we're using these mobile technologies, we're carrying phones around in our pockets, doctors are using their mobile devices to communicate with other doctors. Why are we blocked out by that sea of live operators? And the reasons that we determined was, first and foremost, doctors are inundated with these calls from other providers, from other patients. They don't have a really good way to manage them. And second of all, they're not getting paid for these calls. They're beholden to the insurance companies. The patients are beholden to what their insurance companies cover. So there really hasn't been a really easy way to facilitate that communication. So if you go to the next slide, this is where Ringadoc comes in. For the price of a copay, you can have a same-day instant communication channel with your provider to know what your next step should be. In this case, I could have had the amoxicillin sent to my pharmacy without having to take an entire day off of work and go to the ER. So essentially, what we're providing is instant virtual access to your existing doctor. And as an analogy, think of it almost like an Amazon Prime type experience or a express lane at the airport experience for a consumer. We're actually enabling you as a patient to have a more consumer-like experience with your doctor's office if you want to pay a small convenience fee to get in touch with your physician for expedited service. So an analogy that we like to use is concierge access for the rest of us. We are democratizing healthcare so that premium access is not just reserved for the president who has the doctor down the hall, the wealthy that have the concierge doctor with their cell phone number in their pocket, or those of us that are lucky to have a physician in the family. This is now access for everybody, that you can have direct access for your doctor in this sort of Amazon Prime type model. So we're going to do somewhat of a demonstration. I'm going to actually run you through a situation where a patient has already left me. I'm playing doctor now, so I'm switching hats a little bit. The patient has already left me a message on Ringadoc. Now, what's really important about this, and I know it's compared to all of the other demos you've seen today, it's a little bit of a low-tech, high-tech demo. It's very important that we're getting these patients at the point of current engagement with their doctor's office. And that's as simple as picking up the phone and dialing the same number that they've been dialing for 10, 15, even 20 years. So a patient dials the same number. They don't have to download any application. They don't have to sign up. They're now interacting with our integrated voice response system that takes this previously offline, undocumented interaction and brings it online for the doctor and his or her office to track all of these calls. Now, remember, doctors are already on call for their patients. They were using the live agent system before. They're already available taking urgent calls. So we give them an application that makes them manage those calls as well as these new type of calls, the expedited service calls. So the patient dials the number, and go to the next slide. And then we're actually going to switch over to the doctor's experience on the phone so you can see it very quickly. So you can see here, this is my phone, I'm the doctor. I have a notification here telling me that I have a paid call waiting. Now, this is very important to differentiate. It says paid call, which a doctor is not necessarily used to because they're not getting paid for their time on the phone. So for the doctor, they know that the patient has already acknowledged that they're willing and wanting to pay for the expedited service to get my response on demand. Now, I can have all my other messages in here. This is a collaborative visual voicemail system that I can now manage calls between myself, my other providers, and my staff members. Really important too is at the end of this call, this is all documented. So I can take this patient's message and then I could, listen to it later. I could take notes on it. I could add it to the patient's chart. So we're gonna listen to it. Let's see if we can get the audio of the patient's message here.
Left the following request for a paid consultation.
Hi, doctor. I'm really not feeling well. My stomach is hurting me. It's been hurting for a couple hours. I don't know what I should do, if I should go to the hospital or not. Would really appreciate a call. Thanks a lot.
So in this case, instead of the patient having to go to the ER, unable to get in touch with the doctor, I can go ahead and just press this callback button. I'm not going to do that right now because it will actually initiate a call to this phone and then it will connect me to the patient. But I can then go into a real live conversation with the patient that is now tracked and logged by the Ringadoc cloud system. If there were other messages in here, I have other triaging options available. We're just basically giving doctors the ability to carry around their practice essentially in their pocket with them. And for the patient, it's the same idea. I now have direct access to my doctor just by calling his or her office number. I'm going to switch back here now. So from a doctor's standpoint, it's extremely convenient. That right there, believe it or not, compared to the experience that you used to have calling the doctor's office, that is the simplest, easiest, quickest way to get in touch with a physician. Our average response time to messages is under 3 minutes from the providers on our system. So your doctor, now that the transparency is there that you're willing to pay for expedited service, the doctors are actually handling these requests quite quickly. You can go ahead. So the real takeaway is that we're bringing your doctor on demand. We truly believe that an existing relationship equates to better care. The doctor knows you, they know your medical history, they know your family's history, they've seen you potentially once or twice a year. They're able to have a little more context on why you're calling and what that issue could be. We actually talked to a provider, one of our providers in West Virginia, and he had a patient call him. And he was ecstatic when I talked to him. He said, I saved that patient an ER visit because I knew that patient. I knew the other antibiotics they were taking. And because I knew that patient, I was able to know a lot more about the case. So, why are we doing this? Well, we're all patients. Everybody is a patient. We're all consumers as well. And it's a very large market. And the big takeaway is that 73% of us have trouble accessing doctors. either getting an appointment when we need it or phone advice. I've had this problem. I don't know how many of you have had this problem, but it is a problem that is only going to get worse as we add more patients to the system. We're spending $500 billion on in-person office visits every year. 1 out of every 4 of these visits is estimated as informational only, meaning that there's a large unnecessary pool of visits that are happening because providers are being forced to make their patients come into the office. That's how they get reimbursed. That's the only setting they want to provide care. So from our perspective, this is a really good way to open up a new access point outside of the office. And we're already seeing, too, that outside of the office, doctors are providing care. They're giving away an estimated $100 billion of care outside of the office that they're not being compensated for. So how are we doing to date? Well, we've launched about a year ago, actually almost to the date. We've handled over 900,000 calls on our platform. We have over 1,000 providers in 41 states. This is a solution that isn't just for San Francisco, Los Angeles, New York. We have providers in Montana. We have providers in Tennessee, Nebraska, all over the country using this platform. They cover over 1.5 million patients. And we're very excited to say that we are now generating revenue not just from doctors that are paying us a monthly subscription for this platform, but from their patients that are paying for expedited access to their physician. We take a transaction fee on those, and we also collect the monthly revenue from the doctors. We've raised $1.9 million in convertible debt from a very great group of prestigious investors, Peter Thiel's FF Angel, Sharon Knight, who is a former president of One Medical, a very popular direct primary care facility in San Francisco, and Ryan Howard, who's the CEO of Practice Fusion, a leading EHR firm. And yes, of course, we are fundraising. So if you'd like to discuss, please either find me after, or my email is going to pop up right now. It's just jordan@ringadoc.com. I'd be happy to talk to you and share a little more about kind of what we're looking for, basically expanding the team and building a patient mobile app experience as well. That's the next step. Our team is extremely passionate about impacting healthcare. I myself am a medical school dropout. I try not to remind my mother of this too much. It basically gave me a really good perspective and understanding of the healthcare system and kind of the pitfalls. Micah, my co-founder up here, he's the son of 2 doctors. So we have, all of us on the team actually have a unique experience and reason for wanting to help change healthcare. And we're hiring as well. So we're looking for mission-driven engineers and inside sales reps to really help us bring this product to more people. So, at the end of the day, what we're really excited about from a healthcare technology standpoint is we're one of the few companies that has been able to, in a short period of time, show that we have a model that generates revenue not just from the healthcare providers, but from their patients as well, by giving their patients immediate access to their own doctor. We really are empowering both stakeholders to not be beholden to insurance reimbursement and deciding when and how they can receive care as a way to democratize healthcare. Thank you guys so much. Love to hear some questions.
Hold it close.
All right, thanks, Jordan. My first question is, my only question is, if I was a number crunching physician and I was looking at your platform and picking up a call, I don't know what your transaction fee is, but I get $40. How does that compare to my salary? Am I worried about people who stay on the phone too long and talk to me too much? Yeah.
Sure. No, that's a great question, and some of the doctors ask that question when we're pitching them this product. Number one is you're already taking phone calls, so this is actually taking a percentage of those phone calls and then now allowing you to get paid for them. So you're getting a little bit of that time back with compensation. Number two is the average length of these calls that we're seeing is about 4 to 6 minutes of actual conference time. So to be able to get paid about, let's say, $24 to $30 for 4 to 6 minutes of work, we actually had physicians that at the beginning were quite nervous about doing this, and now they're saying, oh no, I want more calls. I want all my patients to now call me between the hours of 3 to 5 p.m. for phone consults. If you take a look at what the reimbursement would be for an in-person visit, it's probably about $60 to $90, and then you have to calculate the amount of overhead, the fact that the doctor doesn't see that payment for probably 60 days. They like the idea that we do all of that work up front, and it's just cash directly into their pocket.
Other questions?
All right, my second question then is ZocDoc. I know they're on the scheduling side. I haven't seen them doing this, but it would seem that they have the distribution to shift into the space. Is that a worry or?
There are a lot. We get that question a lot from a lot of different angles, not just scheduling, but EHRs. I think that those companies, healthcare is very difficult to acquire doctors on just one product. So I think those companies need to continue to focus on building their core product before they're able to kind of pivot into these type of areas. I think that just like any other industry, there's going to be players that dominate certain aspects of it. I don't think there's going to be one solution that does scheduling, telehealth, EHR, revenue cycle management. I think it's going to be a combination of a bunch of different ones. Hopefully that answers.
Just a really basic point of clarification, sorry if I missed this, is so far is the platform being used by doctors to connect with their existing patients and pay to expedite the calls? Are you also looking at implement patients that just want some expert medical advice at a strange hour of the day?
Sure, that's a great question, and I should clarify. Right now it's for their existing patients, and that strategy is by design. In 2010, Ringadoc was actually the world's first on-demand telehealth marketplace. We have done that. We did see, in our opinion, the negatives of going that model first, and that's why we wanted to work on the existing relationship before we open those providers up to new patients. But we eventually plan to open them up as a way to acquire new patients as well.
Hi, Jordan. Can you hear me?
Yep.
So this arrangement, which is kind of a concierge access, does it violate any contractual agreements that a physician has with a health plan, for example? Because it is payment, could it be construed as reimbursement outside of the contractual terms?
Sure, that's a great question. One of the physician's top concerns. Number one, the fact that we're defining it as expedited service that's optional and out of pocket does get us out of that area of violating the payer contract. So it is looked at in the same realm as concierge medicine. Number two is we do have a system set up where they are contracting with a different professional corp that then puts them outside of that realm as well. Great question, though. Thank you.
Other questions? Thanks so much,
Thank
you
you
guys.
guys.